Director of the Indigenous Health Professions Program. So some of you may have heard about IHPP, Indigenous Health Professions Program. I'll just tell you a little bit about it. We were created in 2017 with a few goals. The first one was trying to increase the enrollment of Indigenous students in the health professions programs at McGill University. So medicine, nursing, PT, OT, speech and language, and a few others as well. We have some partners outside of the Faculty of Medicine as well. And second, we really wanted to stimulate the teaching of Indigenous health topics at all the schools. And we have had several meetings about that, how to do that. And we have partners at McGill that we work with. And we realized a couple things. The first one is it would be very hard for us to do all the teaching at all of those schools. So based on that and community input and input from our partners, we decided that we're going to try to teach the teachers. So that's why we're trying to bring everyone here. And thank you for joining us. We want to teach the teachers what we feel is important to know. And hopefully the teachers can bring that either to their schools or to their clinical programs to do so. And so we actually had a very unique process. We brought together an Indigenous advisory group to help us develop it. And we had actually first planned for a half-day workshop, which was supposed to be happening right around this time this year. Now, a few things happened that threw us off track. And let me just forward this here. So like everyone else, the COVID-19 pandemic struck in March, well, even before that. And so we made a tough decision to postpone our half-day workshop. Now, we are going to do that workshop. It's going to be next year, and it's Indigenous-led, and it will be very interesting. And we invite you to join us for that. And so over the summer, what we decided to do is we transitioned to start with a webinar format, which is where we are today. And so it's a little bit different than what we had intended. Now, some of you may have also joined because of other events that have happened. And I'm going to just show you this photo. I think many of you have heard about the story of Miss Joyce Echequan, a 37-year-old Atikamekw woman who was hospitalized at a hospital in Joliet. And she was in great distress, and she felt she needed to film the video that has become very famous and seen by many people, showing the extreme racism that she was subjected to in the hospital as she was in agony. And unfortunately, Ms. Echequan passed away not long after that video was released. So I modified what we're going to talk about a little bit today to address racism a bit. That was not the original intent, but in our future workshops, we are going to be addressing that in more detail as well. So we're going to start off. Why are we learning about the health of Indigenous peoples? What's so different about it? So let me tell you a little bit about the health status, and it goes all the way back to time of contact. So at the time of contact, when Europeans first arrived on this land, Indigenous people were healthy. You know, things were not perfect, but it is very well believed that Indigenous people were overall quite healthy. There were some conditions and, you know, infectious disease and things like that, but people were very healthy. And in fact, they actually helped the Europeans who arrived here. They helped take care of them because they were sick after their long journey. And they also helped them survive on this land. Now, fast forward 500 plus years. And at this current time, Indigenous peoples have numerous health discrepancies, which we're not going to go into great detail about that today, but it is very well documented. There are numerous health discrepancies. And so what I want you to kind of think about a little bit is what happened in those 500 plus years that has led to those discrepancies. And not only that, what's still happening, because there are still things that are happening, things that are going on. And really what we're trying to tell people about is this is the heart of colonization. And it is not a process that happened 500 years ago. It is still ongoing. We're also talking about the health of Indigenous peoples because this is one response to the Truth and Reconciliation Commission. So many of you may have heard about this commission that was put forward many years ago, and several recommendations were made in 2015. I believe there were 96 actual calls to action. And I'm just highlighting here number 24. It is calling upon all medical nursing schools in Canada to require all students to take a course dealing with Aboriginal health issues, including the history and legacy of residential schools, United Nations Declaration on the Rights of Indigenous Peoples, treaties and Aboriginal rights, and Indigenous teachings and practices. This will require skills-based training in intercultural competency, conflict resolution, human rights, and anti-racism. So this is very important that all students should be learning about this, and we're going to tell you, we're really beginning the process today. So what do you need to know about Indigenous people's health? There are so many things here, and I put together this, this little list. There's colonization. There's really maybe the basics. There's health discrepancies, history, social determinants of health, jurisdictional disputes, 60 scoop. All of these things are really important for students to learn, but where do we start? And today, we are starting with 3 basic things. We're going to go through the very basic things. We're going to go through some history, and we're going to go through some social determinants of health. Now, in future workshops, we hope to address some of the other issues, but this is a place to start. So, we don't really want to offend anyone with anything too basic, but we're really starting with the very basic things of terminology. So, terminology. There are 3 recognized Indigenous groups in Canada. They are the First Nations, the Inuit, and the Métis. You'll see a few other names under First Nations. I put Indian there because that is still a terminology that's used mainly by the federal government. The preferred term is First Nations. In the US, you will hear Native American used. And when I was growing up, one of the terms that was used quite often was North American Indian, which is used a little less often now. So that's one group. The Inuit are a separate group, and the Métis are a third group. And we all come under the umbrella term of Indigenous. Some synonyms for Indigenous would be Native or Aboriginal. The preferred term currently is Indigenous. A few basic points about Indigenous people. There is no one Indigenous culture or one Indigenous language. I actually get asked that a lot, and I'll just give an example of one time I was watching TV, and there were some people, Inuit, speaking Inuktitut. And someone knew I was First Nations and asked me if I could understand them. And there are so many different variations of differences of the culture and language that no, I do not understand them any more than I would understand someone speaking another foreign language I didn't understand. We are very, very different people. There is a great diversity of languages and cultures in Canada, and even right here in Quebec, a great diversity of languages and cultures. In Quebec, we're actually quite lucky that many Indigenous peoples will speak their own language as their first language. We see a lot of the Cree and Inuit at the McGill hospitals. Cree will speak Cree, Inuit will speak Inuktitut. Atikamekw and Innu also speak their language very often. But unfortunately, many languages have been lost, or not quite lost, but really have fallen down in number of speakers. So some First Nations will speak French as their first language, and some First Nations will speak English as their first language. So as I was growing up in the Mohawk community of Ganawage, English was our first language, and that's still what's being spoken there mostly, although we are seeing a resurgence of the language. There are, of the First Nations, there are actually across Canada at least 65 different First Nations in Canada. In Quebec, we have 10 different First Nations. And again, historically referred to as Indians, erroneously referred to as Indians, and that term is still used today, again, mainly with the federal government. And we are the largest group, making up about 60% of the Indigenous peoples in Canada. Inuit. Inuit are the Indigenous peoples that inhabit more the Arctic regions of Canada, and they are closely related to their cousins in Russia, Alaska, and Greenland, but a very different people. The Inuit territory in Quebec is called Nunavik. You may have heard that term, not to be confused with Nunavut. Nunavut is the territory of Nunavut. Nunavik is the northern part of Quebec where the Inuit live. The word Inuit means the people. So when you're saying Inuit people, you're actually kind of saying the people. So it's preferred just to use the term Inuit, and that is a preferred term. And one person of Inuit descent is Inuk. That is singular for Inuit, not to be confused with Innu, who are First Nations along the lower North Shore in Quebec. And they are overall in Canada as the smallest Indigenous group, making up about 4% of the Indigenous peoples in Canada. Métis. This is a term that is actually quite confusing for many people. The Métis are Indigenous peoples who are descendants of people who are of mixed race, primarily First Nations and European. And the origin of the Métis goes way back to really probably the time of the fur trade in Canada. And at that time, there were many couples that came together, mainly European men and First Nations women. And those couples had children. And what happened was, those children were a little bit shunned from the First Nation side and not quite accepted on the European side as well. So they started hanging out together, and families would hang out together. And their children would play with each other. And as time went on, those children grew up and they formed couples and they started having children as well. And this happened in many different areas, mostly as the fur trade was expanding out west. And so there were more and more of these people coming together and families, and several generations passed. And with time, they actually formed communities and transformed into a new and distinct Indigenous culture, different from First Nations and different from Inuit as well. But who exactly are the Métis remains controversial to this day. And when we talk about the history part, you'll understand that a little bit more. So currently, there's actually two definitions of Métis that are out there. The Canadian government uses a definition that a Métis person, first, they self-identify as a Métis person. Second, they are a member of a present-day Métis community. And third, have ties to a historic Métis community. I put a little asterisk there because if you look at the website for the government, they actually go into more definition about what the Métis communities are. There are no Métis communities in Quebec. Now, there is a national organization for the Métis called the Métis National Council. Their definition is a little bit different. Métis means a person who self-identifies as Métis, is distinct from other Aboriginal peoples, is of historic Métis Nation ancestry, and who is accepted by the Métis Nation. So you can just see the Canadian government definition is probably a little bit more strict than the Métis National Council one. And that has actually, there's no one accepted definition at this time. Now, further confusing things are, there are some people who have some Indigenous ancestry, and they may refer to themselves as Métis. And I see this a lot in Quebec. The term Métis is used in French. But these people actually don't meet either of the official, the semi-official definitions of Métis. Now, I'm not saying they're not Indigenous people, it's just they don't really fall in the same category as the Métis National Council would accept or the government would accept. Now here in Quebec, we actually have 11 different nations. One of those nations is Inuit, so they are not First Nations, and the others are listed here. I'm going to see if I can get my pointer here for you. Yes. So Inuit are living in this region here. This is Nunavik. This is the northern portion of Quebec, traditional Inuit territory. The Naskapi are a small group over here near Schefferville. The Cree are living in the James Bay region over here. The Innu are on the lower North Shore, again, not to be confused with Inuit. The Atikamekw are in the Lanaudière region, a little bit north of Joliette. Algonquin are in the Abitibi and Outaouais regions over here. The Mi'kmaq are in the Gaspé region. The Malasits are a little further west. Huron-Wendat, there is one community near Quebec City. The Abenaki are just south of Trois-Rivières, and the Mohawk are the ones closest to the Montreal region over here. There are 3 Mohawk communities. So we're going to go through a little bit of demographics. Canadian First Nations, Métis, and Inuit population in 2016 in the census. There were just about 1.7 million Indigenous people in Canada at the time of the census, compared to 36 million in Canada, so almost 5% of the population. Now, the largest group, as mentioned, are the First Nations. Métis are actually the fastest growing group because many more people are self-identifying as Métis now, and Inuit make up the smallest group in Canada. Indigenous people, we are very young. We are very young people. Lots of babies being born and not as many elders as we would like to have. In Canada in general, non-Indigenous population, the median age is 41. It is 27 for First Nations, 33 for Métis, and 24 years old for Inuit. So very, very young population. So what do we want health providers to know, and what's different compared to the rest of people in Canada for Indigenous people and their health? So we're going to go through a few different things that are very different. There are unique historical factors that are not shared with other groups other than Indigenous peoples in Canada. And because of certain things, we do have a very unique relationship with the federal government that, again, is different from many other peoples in Canada. Those lead in historical factors, and that relationship lead into the social determinants of health and many other factors. And these are definitely related to those widespread health discrepancies that I mentioned earlier. So we are going to start with a little bit of history. I'm not going to go too much into it, it's just some of the very basic things. And I'm going to go a little faster through the next section. The first thing I want you to know is the population decline and what that actually did to our people. It's not really clear how many people, Indigenous people, were in this land we now call Canada at the time of contact when Europeans first arrived here. The estimates are somewhere between 500,000 to 1 million people. Now, what we know is at the end of the 1800s, around the turn of the century, there were probably somewhere down here of about 100,000, 102,000 people. That was really the nadir of Indigenous peoples in Canada. So if you did a quick calculation, that's a decline of somewhere between 80 to 90% of the population, depending on which starting point you have. And you can just imagine the tremendous loss of knowledge that came with that. All your healers, your religious people, your teachers, your educators, everyone you feel is important, you're down 80 to 90% of population within a few hundred years. And what's important to know from that is really we saw a transition from thriving nations to people just trying to survive. And again, that was the beginning 1900s, end of 1800s, and that went on for many, many decades, probably centuries. And we're really just seeing now a resurgence of strength with Indigenous peoples. Other thing to know, very quickly, Royal Proclamation 1763 issued by King George after the what's known as the French and Indian Wars. And what I want you to remember is that there was recognition way back when, 1700s, of Indigenous peoples making up nations. And there's first documented recognition of that by the British Crown in 1763. Next thing to know, the British North America Act, that's actually what created the self-governing Dominion of Canada, set the framework for how the government was going to work. And to this day, very important, established that Indians came under federal authority. And that has implications and has led to many jurisdictional issues for Indigenous peoples in Canada. Now, treaties. What are treaties? You may have heard about this a little bit in your history courses, maybe not. Treaties are agreements between nations that have a unique status in international and domestic law. And in Canada, the federal government agreed to give rights and benefits to Indigenous peoples who signed the treaties, and very often those got extended to other Indigenous peoples as well. And these are managed by Indigenous Services Canada and Crown Indigenous Relations Canada. And this map here shows just some of the treaties and a bit of the timeline. Now, there were a few treaties that were signed before Canada became Canada. They're called pre-Confederation treaties. But I want you to highlight here Treaty number 1, 1871, all the way up to Treaty number 11, 1921. Those are known as the numbered treaties. And with each treaty, as you can see, more and more land was given over to the country of Canada. Now, treaties have been problematic. There is ongoing disagreement about many treaties, especially the numbered treaties, everything that was negotiated in the numbered treaties. If anyone ever looked them up, and they are very vaguely written, they are all handwritten, and it's not really clear exactly what is in there. So you can see that poor communication has led to some of the issues that we're dealing with today. Now, most First Nations people who signed the treaties, they thought they were just, how are we going to live together? Indigenous and non-Indigenous people, how are we going to live on this land? Peaceful coexistence. But for the federal government of Canada, it really became, how are we going to get the land and as little as we can give in exchange? I want to highlight one treaty, Treaty number 6, and really just one line from it. The line is that a medicine chest shall be kept at the house of each Indian agent for the use and benefit of the Indians at the direction of such agent. So this line has become to be known as the medicine chest clause. And this is the basis for a program called the Non-Insured Health Benefits Program that is run by Health Canada. And it is important for every health practitioner to know about this clause and this treaty, because this is what gives some rights regarding health for status First Nations and registered Inuit. They're the ones who are eligible for the NIHB. Now, for political reasons, I'm not going to get into it. The Métis are not eligible. The Métis are excluded from many different things. So what does that cover? The first thing I want you to know, it covers medications. So First Nations and Inuit are actually covered by a completely different prescription plan than most other people. So in Quebec here, many people are under the Quebec provincial plan. We are not. If you're registered First Nations or Inuit, you are automatically in this NIHB plan, and it's different. The formulary is different. It's a little harder to get some medications approved. The process is different. So doctors who are writing prescriptions and they're putting the Quebec code on for certain medications, it doesn't apply to First Nations and Inuit people. The other things that it covers, medical transport. So our clients who come from northern Quebec, this is why they are transported down. It's because of the Treaty number 6. Basic vision care, basic dental care. For our colleagues in rehab, all medical supplies and equipment, things like wheelchairs, braces, canes are all covered through this program, and mental health counseling is also covered as well. Indian Act. We can have a whole class on the Indian Act, but I'll tell you some brief highlights. So this is a law that defines who is an Indian and also outlines several rights inherent to registered Indians. And again, it's in quotations because that's what the term was in 1876, and that's the term that's still used. And a person is considered Indian only if they're registered under the Act, and they're considered and called status Indians. But you know what? It's still the federal government who decides that. It's the federal government who decides whether they qualify. So individual nations cannot really make decisions alone for who is in part of their nation or not. There are many other issues with the Indian Act. One is the many people, especially women, lost their status by unjust practices. So prior to 1985, actually, if an Indigenous woman married a non-Indigenous man, she would lose her status. And it was not the same for the men. The men actually would keep their status. So that really went against, like in our culture, the women have a very prominent role, and so that was, completely took control away from us. There have been many amendments to the Indian Act that have erased or tried to change those oppressive policies. I'm not going to go into great detail today, but the Indian Act used to ban ceremonies, ban traditional clothing, enfranchisement. So over the years, they have slowly, things have slowly gotten a little bit better. But there's many ongoing issues with the Indian Act, and that basically continue to threaten the sovereignty of Indigenous peoples and are really still trying to push for assimilation. Little history about the Métis. So you may recognize the person in the photo. He is Louis Riel, probably the most famous Métis person. He was the leader of the Red River Rebellion that protected Métis rights, and that eventually led to the formation of Manitoba, the province of Manitoba. So very important in our history. And he was involved in not just the Red River Rebellion, but the Northwest Rebellion as well. And eventually the government decided that gee, this guy was too much of a danger, and he was executed for treason in 1885 for his role in those rebellions. And many people actually went into hiding. Métis people went into hiding after his execution. They got a little afraid that the government was going to come after all the Métis. And so, for about 100 years, the Métis Nation was not that strong. They're getting more strength now, but you didn't hear that much about the Métis for a very long time. Now, although the Métis were recognized when the Constitution Act was written in 1982, their rights were not really fully recognized. And I'm not even sure I could say fully recognized, but beginning to be recognized until 2003. So 17 years ago, with two brothers who went to court to fight for hunting rights, the Powley brothers. And they won, and they got formal hunting rights as Indigenous peoples. And that was really a wake-up call for the Métis Nation, from my understanding. And unfortunately, the Métis have not shared the same rights as First Nations and Inuit, and to this day, they still do not have the same rights. Again, they are in evolution as a nation. Now, the Daniels decision is something that's very important for the Métis people and for non-status First Nations as well. They actually went to court and won. The judge ruled in their favor that they should get basically all the same rights and benefits as First Nations people and Inuit. Again, the term that's used is Indians in the legal wording. But unfortunately, to this day, 4 years later, nothing has really changed much for them. So based on this history, the laws, the treaties, everything that you've heard about, the federal government agreed to many shared responsibilities with Indigenous people for housing, for drinking water, for education, youth protection system, healthcare, and many other things. But you know what? Most Indigenous peoples feel the government has just not been honoring their responsibilities, and it's been a little over 150 years now of inadequate funding for all of those things, which has led to many of the issues where we are today. And again, Métis have been excluded very often. Now, I can't tell you about history without telling you just a little bit about the residential school experience. Some of you have heard some of it, but maybe it's news to some of you. The residential schools did exist in Canada roughly 1882. You'll see different years listed, but late 1800s up until 1996. 1996, a system established to civilize Indigenous peoples. 150,000 children were forcibly removed from their homes and sent to these boarding schools. These were paid for by the federal government and operated by the churches. The children were forbidden to speak their own language or follow their traditions. They were places of emotional deprivation. Very high levels of physical and sexual abuse were reported. What you don't know about is many children actually died, mostly from tuberculosis and other infectious diseases. There were things that happened at the schools that we just can't understand today. Children were part of nutrition experiments. I've heard reports of electric chairs at some of the schools even. And the last school closed just a little over 20 years ago. This quote is from Duncan Campbell Scott, who was basically head of Indian affairs in the 1920s, 1930s. I want to get rid of the Indian problem. Our objective is to continue until there is not a single Indian in Canada that has not been absorbed into the body politic, and there's no Indian question, no Indian department. That is the object of this bill. So a pretty clear policy of assimilation from the government of Canada at that time. The aftermath of the residential schools has been devastating, left a legacy of children who lost their language, their customs, sense of family, and they didn't learn how to become parents. They didn't learn how to manage their emotions. They did not grow up in families. And many people have said this is basically 150,000 children who were subjected to child abuse. And what we're seeing still today is a long-term intergenerational effects by many Indigenous peoples today, because those kids came home, often they started having children themselves, and they did not know how to be children. So everything they learned at those residential schools, they didn't want to do it, but somehow got passed on to their children. And it's felt that this is part of the core of depression, PTSD, substance abuse, many of the other issues. It's not the only one, but it's one of the biggest ones. Okay, so that's just a little bit of history. We're going to go on to some of the social determinants of health now. And I'm just going to hit you some of the highlights. The first one is housing. And the provision and management of housing on reserve lands is a responsibility of First Nations with support from the Government of Canada. The reality is we are seeing overcrowding, old homes, mold-in homes, poor air exchange, poor air quality. I'm going to show you a video of Attawapiskat, came out in 2018. It's down below here is the reference. They've had several different housing crises, and I'm going to do my best to show this to you. I'm going to stop this. It's about 1 minute.
What is this then? What's it like living here?
Cold, you're cold.
I'm told this is actually condemned.
It's a condemned, yeah.
So what do you do then?
I still live here. They don't give me anything, so I still live here.
Whose fault is that?
Because I bought this house a while ago, I don't know, about 16 years, over 16 years ago.
Okay, so I'm going to try to close that. Here we go. So not all the homes are like that, but unfortunately many are. And just to give you some idea, we need probably somewhere between 35,000 and 85,000 new homes for Indigenous peoples in Canada. So again, it just speaks to that 150 years of not getting the job done and underfunding has led to just this crisis in many different communities. Drinking water. Clean, safe drinking water is, again, a shared responsibility, and many communities in Canada continue to have long-term drinking water advisories. At this time, there's 61 long-term drinking water advisories, so maybe about 10% of the First Nations communities. So you would think in a country like Canada, we can get clean drinking water to everyone, and it's just not happening. And these long-term drinking water advisories, we're not talking about a week or two, we're talking about months and sometimes years. Sometimes some communities just have no access to clean drinking water, and they're still shipping water in. It's just unbelievable that this is still happening. Education, again, a shared responsibility of the federal government and First Nations and Inuit. The government is responsible, funds elementary and secondary education for First Nation students, ordinarily resident on reserve, and provides post-secondary education and financial support for eligible First Nations and Inuit students. The reality is, if anyone has ever gone to the communities, you'll see schools kind of falling apart, underfunding for teachers who for special needs children, not enough computers, not enough supplies, and that's one of the main reasons we're not seeing many come into the higher education, because it goes way back to elementary and high school not being fit. And we are still seeing poverty in many of the communities. This is just a quick graphic here. In Canada, let me see if I can get the highlighter for you again, laser pointer. So this one here is the Indigenous on reserve, close to 60% child poverty. Off reserve, 30% poverty, compared to about 18% poverty, which I think is still too high in Canada, but 18% poverty for non-Indigenous children. There's many other social determinants of health. We don't have the time to go into all of those today, but similar story for many of them. Now, stereotypes. And this is something that we deal with, unfortunately, quite often. Stereotypes, these are the things that lead to racism, microaggressions, and other issues. And you probably have some idea of what are the stereotypes that are out there, but some of them that are out there: alcohol, homeless, especially in Montreal. You might think all Indigenous people are homeless. You hear often, oh, Indigenous people are lazy, taking handouts from the government. Oh, they don't pay any taxes. It's not fair. They don't take care of themselves. They're sick because they don't take care of themselves. Well, the reality is, it's really hard to take care of yourself when you're given all these negative factors in your life. They're getting a free ride. You hear that. These last two, illegal activity, I hear that one quite often. These last two quotes are what was in the video against Joyce Echaquan. Just good at making babies. I think they actually said something a little more vulgar, which I didn't put in here. And it's us who's paying for them. So this undertone that people are paying for us to just sit around and do nothing, which is just not the case at all. Now, unfortunately, racism, stereotypes, and these microaggressions are pervasive in our society, despite what our politicians may say. And unfortunately, we see it in healthcare as well, including the McGill teaching sites. I have medical students and residents talking to me about it now and then. And I really feel that a lot of people just don't even know the basics. That's why we decided to start with the basics here, because you don't know the reality of that Indigenous people face. And so these stereotypes are out there. So, it's very easy to follow along with those. And I think, so I'm very glad you're all here with us today. I think it's important to continue to inform yourself, address racism and microaggressions in your institutions. It can be difficult to do, but knowing the truth is very important. And yes, attend our future events as well. Just going to finish off with one note about resilience. A lot of what we just talked about is quite difficult to hear, but you know what? We're doing okay. We're actually doing quite well. Many Indigenous communities are starting to take control over their own healthcare, and sometimes have been doing so for many years. Our population is back again, and we are thriving and we are growing. So we are now transitioning back from that survival mode into thriving communities again. We're starting. There are many model communities that have made a difference. And one of the biggest things we're going to talk about when we finally get to meet you all in person in that half-day workshop is we're going to talk about resilience quite a lot. So quick conclusions. Again, there are 3 recognized Indigenous groups in Canada. They are the First Nations, Inuit, and Métis. Indigenous peoples have a unique history and unique relationship with the federal government compared to non-Indigenous peoples in Canada. And this has been the setup for those poor health outcomes that we're seeing today. These unique aspects continue to lead to many health discrepancies, and those are the social determinants of health that we talked about. And unfortunately, racism is pervasive in our society and in healthcare, and we all must do our part to combat racism. So I'm just going to take the last minute here just to tell you a personal story about myself. I did, as I mentioned, I am a First Nations person. I grew up in the community. In medical school and residency, I did a lot of work with First Nations people. and then started work at the Children's Hospital in 2000, and I started going up to the James Bay region over here, taking care of the Cree children. So I was doing that for 4 years and also working in my own community. And in one of my colleagues who was going up to the Hudson Coast here could not continue that work, so they asked me to take over for those communities, which I did for a few years. And in 2004, I went to Inukjuak, a very, very nice Inuit community. And I'll just share with you something quickly. So I was staying in the Co-op, which is the local hotel. And in that, anyone who's been up north, you know, very often you have to share the kitchen with everyone. And I was sitting there making my supper. And an Inuit family from another community was staying there as well. And they came and were starting to enjoy their supper. And it was very different. And they came in and they had a cardboard box, and they opened up the box, or it might have been a couple of boxes, and they put that on the floor, and they all sat down on the floor. And then they had a cooler with them, and they went to the cooler and they took out a very, very large fish. I believe it was an Arctic char, and they put that in the middle, and then they took a knife and they actually started slicing the meat right off of the fish, and were eating it like that, and eating it raw. And that is, you know, their traditional food. And they were speaking in Inuktitut, a language which I did not understand at all. And I remember standing there and just feeling like, oh my God, where am I? This is so much different than what I am used to. I actually felt like I was in a foreign territory. I really felt like a foreigner where I was. And so I'm sharing that with you to let you know that, you know what, if you feel like you don't know exactly what to do, how to work with Indigenous peoples, that's okay. That's okay, because it's not natural for everyone. And even for myself as an Indigenous person, I was not that comfortable working with Inuit, and still have a lot to learn. And so that's why you're here. You're learning, and as long as you're treating us with respect and understanding, you're going to do fine. And it's a learning curve. It's really a lifelong learning curve for all of us. So with that, I just want to say, please keep in mind that we are going to have more events in the future. And in our language, I will say, Nyawa, thank you, merci beaucoup. And I'm going to try to answer any of the questions in the chat. We have a few minutes left for questions, and I am going to ask Alex if you can kind of summarize some of the questions for me.
Absolutely. So one of the first questions I've seen a few times is people are asking, they understand the recording will be available, but they're asking if the slides can also be available as well.
I have no problem putting the slides. I guess I'll talk it over with our team, and I'll talk it over with faculty development. I personally have no problem putting our slides on our website as a presentation. We might have to put it in PDF format or something like that. And so we'll double check if we can do that, but I certainly have no objection to that.
One other question that I read talks of, let me just make sure I'm reading the right one here. Talks about basically what can health professionals or future health professionals do in their practice to help in adhering these changes towards better Indigenous health.
So I personally feel that it's very important to learn more and learn some of the basics. Now, when I talk to medical students, one of the things I talk about very often is how to become a culturally safe provider. And what I challenge the students with there is, it's very important to first do a self-evaluation of what's important to you. I'll give you an example. So when I used to go, especially to the northern communities, I would talk to families, and just part of my questioning would be, what grade is your child in? And very often they weren't 100% sure what grade their child was in. And when I first saw that, it was a bit of a shock to me, because for me, my culture, how I grew up, education was very important. That was, it's probably more from my family. And so I realized that I was making a judgment because that is what is important to me, but I was making a judgment to them. Now, when you think about the history of residential schools, the fact that when you go to school that you can't really, there's not as much teaching about the language and the culture at the schools because they have to follow the school recommendations, that, you know, it might not be that obvious that school is the best thing for many of the Indigenous peoples. Now, you know, we could have a lot of debates about that, but what I think is important is do that evaluation of what's important to you and know where you stand on things, and realize that when your Indigenous people are talking to you about certain things, they may not have the same values of you as you do. That's okay. You don't need to agree with them, but just don't pass that judgment on, because it's almost a reflex. You know, oh my God, you know, like when I was hearing them about school, you don't know what grade your child's in. How can you know that? But you know, that's a judgment, and we have to be very careful about that. So that's definitely one thing I think it's important for everyone to do, that self-evaluation and try to catch themselves when they're making judgments. Alex, I think we'll do one more question, then we'll do our closing. And just a refresher for everyone, we are going to do our best to answer all the questions, and that will be available on our website.
Right. For one more question that I'm seeing, somebody is asking if they wanted to learn a few words of a language in a territory that I'm assuming they're working in. How should they go about asking for resources, or what resources should they tap into?
Okay, so it depends where they're going to be. Now, if that person is based in the Montreal region, there is actually one of the Native Friendship Centers actually offers a lot of courses on Indigenous languages. And if you went into just to do a search for Native Montreal, you will find that Friendship Center, and there's information on their website about languages. There actually is a lot of other things online too, but that one is in person. I'm not sure what they're doing during the pandemic, but that is a place where you can get a lot of teaching about languages. So I feel very comfortable directing people there. Now, with that, our time is up. So I just wanted to thank everyone again for joining us. We really appreciate it. We've had an amazing turnout. And I look forward to seeing you at future events. And again, all of this information will be on our website, and we will try to address all of the questions as well. With that, I will ask Calvin to do a closing for us.